if you want to avoid all the sickness this winter, the snotty noses, the coughs, the colds, the sleepless nights, the fevers, the Panadol and the antibiotics, the ear infections, the grumpy, tired kids, the days off work and school and childcare, are all those memories of last winter coming back? I'm here to tell you that it doesn't have to be that way this winter. I have a free online masterclass, 3 simple ways to boost your kids' immunity to avoid a winter full of sickness. It's on demand, meaning you can register and watch it straight away or watch it at a time that is convenient for you. Head on over to naturalsuperkids.com/immune and you will be able to sign up. In the masterclass, I am covering our natural, simple and effective approach to avoiding winter infections, how to boost your family's immunity with our proven 3-step naturopathic strategy that is really easy for you to implement as a busy mum. We're going to talk about the immune depleters that you need to avoid so you're not wasting time and money building up your kids' immunity that is just being depleted by these common foods and environmental factors. I am sharing heaps of practical tips. I promise it will be an hour well spent. You can register again at naturalsuperkids.com/immune. I can't wait to hear how you find it and to give you the tips to make this winter healthier. Welcome to the Natural Super Kids podcast, where you will discover practical strategies to inspire you to boost the health and nutrition of your kids. I'm Jessica Donovan, a qualified naturopath specialising in kids' health, and I want to make it as easy as possible for you to raise healthy and happy kids. Let's get into it. Hello, welcome to the Natural Super Kids podcast. Gosh, I'm excited to bring you today's episode. I just have to pinch myself sometimes in terms of the amazing people that I get to have conversations with for this podcast. And Dr. Robert Melillo is, really one of my favorite guests so far. We are talking about his revolutionary method in today's podcast called the Melillo Method, and he just has so much wisdom to share, as well as so much real life practical information to share as well. We go off on a couple of tangents in this episode. Off air he was giving me some parenting advice in terms of my kids and the teen years. His kids are in their 20s, so I just really appreciated the time that he so generously gave to this conversation. You'll hear how busy of a man he is. If you haven't heard of Dr. Robert Melillo, he is one of the most respected specialists in childhood neurological health and neurological disorders in America. He's been helping children overcome learning disabilities for over 30 years. His area of expertise includes autism, ADHD, OCD, dyslexia, Asperger's, Tourette's, Bipolar, as well as many other mental, attention, behavioural and learning disorders. He's an expert in diet, nutrition and neuroimmune disorders in adults and children. He talks more about, all of the amazing things that he has done. He's one of those people that you talk to and you think, how do you find time to do all that you do? An amazing man, an amazing conversation. I'm really excited to hear how you find this conversation with Dr. Robert Melillo, and we will make sure all of the links to find out everything that he talks about in this episode are in the show notes. So they're really easy for you to find. But I would love to hear from you once you listen to this episode. Please reach out to me on Instagram over at Natural Super Kids and give me your feedback. Let me know how you found this episode. And also, other guests that you might want me to have conversations with on this podcast. I'm always open, to hearing about different experts that you'd love to hear from. So here is Dr. Robert Melillo. Welcome to the Natural Super Kids podcast, Dr. Robert Melillo. I am very excited to talk to you today.
Very excited to be here. Thank you for having me.
So we, really excited to pick your brain about brain health. And I guess I'd love you to start by telling us a little bit more about you and your work for some of our listeners who may not know about you. Sure.
Yeah, well, I'm a clinician that, I have multiple degrees in various areas. I started off in the field of chiropractic and neurology. I have degrees in neuroscience. I have a degree in clinical rehabilitation neuropsychology and a PhD in cognitive neuroscience. And I've spent most of my career not only treating patients, but also doing research, teaching. I'm a postgraduate professor of developmental functional neuroimmunology. I've kind of taught many doctors and therapists all over the world, trained over 10,000. I also developed a group of centers called Brain Balance Achievement Centers that I co-founded about 15 years ago, where we had up to 100 plus centers in the United States where we work with 100,000 plus kids. I've also been in my own clinical practice. And over the last couple of years, I've been in practice in New York and developing the most sophisticated level of my work, which is what we call the Melillo Method. And we have a center here in New York on Long Island that we've been here for a couple of years. And, I have also 8 best-selling books. Number 1 book is Disconnected Kids, which has been translated into about 15 different languages. I've published about 100 scientific papers and written a textbook as well as 20 chapters in other textbooks. So, I've been pretty active and trying to really bring it all together, really with the goal of trying to understand what's happening in the brain and in the body of anybody with some sort of developmental neurological issue.
Yes. Wow. You have been a busy man. That's a lot that you've kind of got under your belt. And I love that you've got that real, that expertise and that knowledge from everything that you've studied. But obviously you've also got so much like real life hands-on experience with these issues that we're going to be talking about or challenges that we're going to be talking about today. So, as we will talk about, you have a revolutionary approach to things like treating and supporting kids with autism and ADHD and OCD and Tourette's and so many other conditions that are related to the brain. But what I'd really love to start with is I'd love you to explain to our listeners what is going on in the brain in kids that are autistic, that kids have been diagnosed ADHD, OCD, Tourette's. Can we start there?
Sure. And that's, I think for me, the most important question, right? Any given day you can be here in my office and we have people from all over the world, especially like on a Monday like today, people fly in from all over. And they've, tried everything and really, are really motivated to, obviously, many of them, their children or adolescents are not speaking. And they're, the first question I ask them is usually, has anybody tried to explain to you what's actually happening in your child's brain? Or if it's an adult we're working with, is say to them, has anybody explained to you what's going on in your own brain? And the answer is always the same. They look at me and they say no, and like no one's ever even tried to explain it. And for me as a parent, when I was told that, my children had certain issues, the first thing that popped in my head was, well, what is it? What's happening in their brain? And I already knew a lot about neurology, and I already was a clinician, and I, wanted to really know specifics about what it was, what was the issue, before I could hope to think, well, what can we do about it? I needed to know what the problem was. And so for me, that's been, my search. My career has been about really trying to get to that at the deepest level and really understand what the problem is and really do the research to really prove it, not just to understand it, but how do we change it? How do we make a difference? And how do we correct many of these issues? And one of the biggest mysteries to me is, why do some children with autism, why are they not able to speak? And that is something that I think over the last couple of years, I've really been able to understand that at a really deep level. So the bottom line is, what we know is the reason why many of these issues are so mysterious is because there's no obvious brain injury. There's nothing wrong with the brain per se. If we look at an image of the brain, an MRI, it looks perfectly normal most of the time. There's no general metabolic issue in most of these people that, they have obviously nutritional and biomedical issues, but it's not a metabolic disease. We also know in most cases, more than 95%, there is no genetic mutation or anything really wrong with their genes per se. So the question is, well, what is it? What's happening? What we've been able to show is that there is this maturational developmental imbalance that happens in the brain during development, and especially within the first few years of life, that causes this developmental imbalance really primarily between networks on either side of the brain that prevents their communication and integration, but also we see areas of the brain that are overactive, that are too active, and that can produce symptoms. Like in autism, for instance, the left side of the brain being overactive will cause things like tics or stims or OCD behaviors or hyperactivity or anger outbursts or tantrums. And it can even cause overactivity of the immune system, which can cause chronic inflammation and other issues like that. And on the other hand, we have areas on the right side that are underdeveloped and immature. And so we may see a lack of drive for social and emotional communication. They don't really feel or aren't very connected to their body. They lack what we call interoception and proprioception. And they really, don't really understand a lot of social emotional cues. And they can't really control a lot of what's happening with their left brain. And this type of imbalance is what we see in virtually any sort of mental health or neurodevelopmental issue at any age. And most of this really happens within the first, 5 or 6 years of life. And what happens in those first 5 or 6 years really forms the fate of the adult brain. And so these imbalances is really the core issue. And depending on whether it's areas within the left brain and what areas in the left brain are overactive and the areas right or vice versa will really depend on whether we're looking at something like ADHD or autism or OCD or Tourette's or tic disorder or dyslexia or a learning disability or bipolar or schizophrenia. And obviously, because it's the brain, it also impacts the digestive system, the autonomic system, the immune system, and all of those, hormonal type biomedical issues that we see as well.
Yeah. And I love that you're, just highlighting those links as well, because I think a big issue with our modern medical approach is that everything is so disjointed, isn't it? There's specialists for the brain and they don't look at the immune health or the gut health. And in our work, we talk a lot about, that holistic approach to health. So thank you so much for understanding that. And I think that's going to be like, whoa, to so many parents that are listening because they've never heard about these conditions or challenges in kids being explained that way. I know you talked a lot about, these imbalances. I think you call them functional disconnections, or these brain imbalances in kids, and how they sort of occur early on. So, how do parents, I guess, pick up? Or I know you talk a lot about milestones in your work as well, and the importance of milestones. So, can you talk to us about that and how parents might be able to pick up some of these imbalances early on, in life?
Sure. Well, first of all, what's really important, I think, for parents to understand, because, all of this can be overwhelming. And I started as a parent that was being told all these things with no real answers, and told that you just need to accept it and there's nothing you can do about any of these issues, but no one could explain to me what these issues really were. And really, what starts this process is that every kid or adult that we work with here, is that it starts off with that they're gifted in an area of their brain. I mean, every child, every kid with autism, whether they're verbal or nonverbal, is a genius with their left brain. I mean, they have these genius level skills. They may not be able to show that to us, they may not be able to control it, but it's there. And, whether it's a right brain or left brain issue, it usually starts with the opposite side of the brain being very gifted. And so most parents, are kind of led to feel like, or they may ask me, what did we do wrong? Did we do something wrong? And the answer is, you did nothing wrong. If anything, you gave your child really strong genes, and you gave them a gift of this extreme ability and talent. And that also leaves them more vulnerable to these types of imbalances. But the good news is that we can change it. And, many of these start early. I mean, I have many, many, many moms that have told me my child was hyperactive in the womb. I mean, they were just kicking and moving. And we know that many of these things do develop in the womb, or early in childhood development. And there's many different reasons or things that might lead to it. My third book was all about looking at different environmental factors, and genetic and what we call epigenetic factors that can create certain imbalances. But again, the good news is that most of these things are changeable, and that the earlier we can identify things, the better. And some of the earliest signs are any alterations of motor development, muscle tone, or immune dysregulation really early on. No kid should have eczema in the first year of life. And if they do, then there's something going on, right? There's an overactivity, there's an imbalance in the immune system. And all of the milestones, like when a child should roll over, when they should crawl, going through these different stages is very important. And it's really important because most pediatricians are minimizing that and saying that it's not important anymore. And I can tell you that's completely wrong, that how the child moves, when they crawl, when they walk, when they talk is hugely important. And even little bits of a deviation really signify that there's an issue. And we know that, that is often related to something called retained primitive reflexes, which is one of my primary areas of research. And that, we can change those things early on. We can intervene early on and really change the whole developmental trajectory of the brain, which is really the issue. So looking at, those milestones, and also when a child is younger, most parents, they know many of these kids, again, a kid with ADHD, typically, we know that there's this, what we call this unevenness of skills. They may be really advanced in certain things. Even kids with autism, we see some of them have what we call hyperlexia, which means they can read before the age of 2, but yet they may be delayed in speech, or they may, be really delayed in social development or emotional development or nonverbal communication. Kids with ADHD are usually very, very bright, but yet they may struggle in other areas. And so there's this real imbalance in their child's skills. Early on, they can see this. And again, that to me is also an early sign that there's some sort of developmental imbalance in the brain.
Yeah, so interesting. And I've heard you talk about even like latching on the breast with breastfeeding, babies like that early, the babies that struggle with that. I mean, that's a milestone that should be met. And if it's not being met, then we can do something about that then and there, can't we? Rather than waiting until they're 8 and struggling at school.
Exactly. I mean, to me, again, anything that alters normal muscle tone and motor development is really the foundation. That's the foundation of how the brain is built. And when a baby comes out and they can't latch on, that usually shows that there's low muscle tone around the mouth, which is related to the brainstem development and an area called the cerebellum, which we know is very involved with, with all of these different issues. Um, and again, how they roll over. I mean, from the very beginning, if they're not rolling over in the right way, if they're just flopping over, or if they're delayed in rolling over, to me, those are two of the earliest signs that something's going on, and that we can start the intervention right then and there and often change it very, very quickly. And like we said, I mean, if a child has immune issues early on and, has things like reflux and all of these different things, and kids may have latching problems. And now, many of them are being diagnosed with having lip ties or tongue ties, but I don't think that's the case as much as we think. I think it's just that when a child has tone issues and is having trouble latching on, the first thing that we go to is say, oh, it's a tongue tie or a lip tie. But, I see that even when they're repaired, it doesn't usually change that ability to suck or root. A lot of it has to do with these early primitive reflexes like the rooting and the sucking reflex and the snout response. And these are early reflexes that are about muscle control of the mouth and the tongue. And this, if that doesn't get corrected, then that also, usually leads to speech delays.
Yeah, wow, so interesting. And I think there's this, movement to like, well, don't compare your baby to another, but there are important milestones that they need to be meeting. And if they're not, then yeah, we do definitely need to dig a bit deeper. And I'm really resonating with what you're saying about the lip and tongue ties. I mean, I've just talked to so many parents who have had them corrected and there's still issues. So again, digging deeper, and it's so interesting you talking about like reflux and eczema. These are all really common issues that, are really prevalent in very young children these days. So again, I think this is going to be mind-blowing for a lot of parents listening. So tell us more about your approach, the Melillo method in treating these or correcting these functional disconnections and brain imbalances in children.
Yeah, well, like you said, when I teach other doctors, or the way I look at it is there's what I like to call a brain developmental blueprint. If you're building a house, if you're building a building, there's a blueprint that you have, and there's certain basic things that you need to have on that blueprint, and you need to follow that blueprint pretty closely when you're building it, right? And I believe that there is this blueprint for our brain, and I think it's important to compare children because that's the only way you're really going to know when there's a deviation. And I think that, on one hand, there's this move for acceptance and everything, which is great, and it's very compassionate and is important. But then there's also the idea that everybody says the earlier we can recognize this, the better we can intervene. But yet most kids with autism to this day aren't diagnosed until they're 4 or 5, which, we can identify many of these issues in the first year and start to intervene right away. So on one hand, if you're not comparing, if you're not looking at what would be typical, what would be optimal, and even with parents, they often see it, if it's your first child, you don't know. And it's hard because you don't have anything to compare it to. But then parents will often, when they have a second child, they'll say, wow, I didn't realize how delayed and how, my child was so far off from their milestones. Now, when I see my other child develop, or if they already had a child that developed in, more typical way, and then they look and they go, wow, they see it really glaringly. And so it is important because, if they're from the same family with essentially the same genes, they should develop there's a certain time frame that we know has been around, and that time frame is important. And so, we need to look at those things and we need to be able to say, okay, what do we do about it? So with me, it's all about, getting that. First of all, looking at, what would deviate that and any alteration in tone, or if we see these retained primitive reflexes. Primitive reflexes are these programmed movements that we're all born with that allow us to move because human babies are very immature. Our brains are really, the most immature brains, and human babies are the most immature and lead the longest period of time for development. And boys need a lot longer than girls, which even makes them more susceptible. It's why we see 4 times as many boys with autism or with OCD or with tic disorders or ADHD than we do girls, because anything that alters that developmental trajectory or slows it down is something that's going to have an impact on brain development. So identifying if these reflexes are there, intervening and helping them to be integrated is really the first step. And then we also want to create balance, because once we develop these imbalances where one side of the brain usually comes online too early and the other side hasn't fully developed, then that is where the symptoms can be explained from. And then we need to, in many cases, get them improve their muscle tone, improve their coordination and their connection to their own body. And then we need to look at what's happening with their gut, what's happening with their immune system, what's happening with their metabolic system, and do things that can also help that as well.
Yeah. So, I mean, it sounds like there's multi factors and multi kind of, different approaches that you have within your method. And I'm guessing it's individualized for each child as well.
Yeah. I mean, we do an extensive exam and evaluation. And then based on that examination, we put things together. But it's a combination of various physical types of stimulations and exercises, getting them to move in certain ways. And we are using sensory stimulation. People say, well, how do you stimulate the brain? Well, one way is through natural senses, right? Light, sound, smell, temperature, vibration, inner ear, spinning, eye movements, different frequencies of sound, different frequencies of light, different flashing. Those are things that are very powerful. That is what initially causes the brain to grow, and feedback from our muscles. But we also can do things cognitively. We can work on academic skills. We can work on speech skills. We can also do different types of advanced stimulation where we can use things like different lasers or light therapy, photobiomodulation to change brainwave frequencies. We can use different types of electrical stimulation that is safe but very effective, things like a TENS stimulation that we can use on the body, or use things like transcranial direct or alternating current, or we can use different things like neurofeedback, which is much later down the road. That's never a first line therapy for me in children, but it's something down the road. And we have, these different stages that we take them through and different tools. And there are a lot of great tools out there, but the key is using them in the right way at the right time for the right period of time. And that's where, there's a lot of people that just want to jump on a tool and say, let's just do this and let's just try to stimulate. But it's really about doing it in a very directed way and in a very specific way. And that's really what the Melillo Method is all about. It's using objective functional measurements that tell us, this is what we need to do now, and then we need to do this, and then this, and then this, and all geared towards a specific goal, which is geared towards using objective measurements of development and brain function. And we're just trying to bring out the best of that individual child. We're not trying to change anybody. We're just trying to bring out who they're really meant to be and have them be the best version of themselves.
Yes, I love that. And, it just sounds so helpful. for so many families out there. So one of the things that we, I think, agree on is the importance of diet and nutrition when it comes to our children's developing brains and just brain health in general for kids and adults. So what are some of the key things you would like parents to know when it comes to, yeah, diet and nutrition for brain health?
Well, I think that, as you know, I'm sure you deal with this all the time, is, the first thing people talk about right away because they read about it is, well, we need to eliminate gluten and casein. And yeah, that can be helpful, but many children have many different food sensitivities, and gluten and dairy aren't evil. They're not bad per se. In fact, they can be pretty good foods. And it's more important to understand, no one should have food sensitivities like that, right? And, especially when we see kids that have 30, 40, 50 different food sensitivities on a blood test, there's no one that should have that, right? So we have to look deeper and say what's actually happening with their immune system and what's happening with their gut. If someone has a food sensitivity, then right off the bat, we know their gut isn't working properly, that they have a leaky gut, and that their immune system is dysregulated. And why are both of those systems not working? And it really is because the brain is not working and not developing. And it really comes down to an imbalance in the sympathetic and parasympathetic nervous system, or the fight or flight versus the rest and digest system. And that the core of it is neurological. So that you need to understand that, because although doing things with diet and nutrition and vitamins and supplements are very important, that you also need to deal with what's happening in the brain and in the nervous system and in the brainstem, which is often the core problem of why there's a problem with the digestive system. And that, so there's no one diet that fits all, and there's no one or two foods. It kind of makes me a little crazy when I see things out on the internet or different, people or health professionals putting it out there, and they pick one thing like, oh, your child just needs magnesium, or they just need folic acid, or they just need B12, or they just need to do this one reflex. And it's not that simple. It's never that simple. But it's usually a mixture of different things, and it really needs to be tailored towards the individual child or the individual patient. And lab tests, can be really helpful in identifying all of these things, and just understanding that you need to really look at what's happening in your child and try to tailor a specific diet. It's like people used to talk about, we need to boost the immune system. Well, now we know it's not really about boosting the immune system. It's really more about balancing and targeting the immune system properly, just like in the brain. It's not just about randomly, haphazardly stimulating the brain. It's about doing it and creating balance in a directed way.
Yeah, and I love that example you gave of, the long list of food intolerances. I mean, we see that all the time, and it's like, yeah, but and they'll just kind of be self-diagnosing or get some advice that you just need to cut all of these things out of your kid's diet. It's like, no, that's not the crux of what's going on here.
No,
Yeah.
if a child has multiple food sensitivities, there's a number of things going on. One is, I use the term leaky gut, which I'm sure you talk about a lot. Most people don't realize that we start off life with a leaky gut, right? That we all babies, when they're born, have their guts are more open. Why? Because there's something called the innate immune system and the adaptive immune system. The adaptive immune system is fairly unique to humans. We have the most sophisticated immune system, but we're not born with that fully online when a child is born. And part of that system is forming antibodies. And so babies don't form their own antibodies initially. And so they need to get them from the mother, and they usually get it through breast milk. And these antibodies are large protein immunoglobulins, and they normally wouldn't get through a fully mature stomach lining. So the gut has to be open to allow that to happen. And in the beginning, a baby's just supposed to be taking in milk, breast milk. So there's no need to really digest things a lot. We don't need a lot of digestive enzymes or acid in the stomach, and it's pretty easy and it just gets through. So we don't need a whole lot of blood flow in the gut initially. And this is where the baby is more in what we call a sympathetically dominant tone, where their sympathetic nervous system is high and the gut is open and they don't have a lot of, blood flow, and they're not producing a lot of digestive enzymes and acid. But then as the brain matures and as the gut matures and as the baby starts taking in solid food, that gut needs to close up. They need to start producing acid. They need to start producing digestive enzymes, and we need to increase blood flow to the gut so we can absorb nutrients that they break down, and vitamins and amino acids and all of those things. And that is when the parasympathetic nervous system starts to kick in. And that is, should be fully online by the first year. The gut should be closed up and the baby should start sleeping through the night and should start being able to eat solid food. What we see is that if somebody still has food sensitivities, it's one, if they have a leaky gut, it's most often that it never closed. It didn't that something happened to it. It's that it never really closed to begin with, because the brainstem, which should be regulating this, and the balance of that parasympathetic, sympathetic nervous system, it didn't happen. And one of the reasons why it didn't happen is because if these primitive reflexes don't go away, they come from that lower brainstem area. And as that area matures, that's when the parasympathetic nervous system should kick in, the gut should close up, we should digest food and get normal blood flow, and we start regulating our immune system and our adaptive immune system. The Th1 and Th2 system should fully come online. And what we see is that in kids that still have primitive reflexes, they have these imbalances in their brain, but they also have these imbalances in their parasympathetic and sympathetic and their immune system. Usually they have what we call a Th2 dominance, where their antibodies are overly sensitive and they're producing antibodies against things that they shouldn't produce antibodies, like foods or like their own body. And antibodies don't kill things, but they mark things to be attacked by the immune system. And if they're oversensitive, then we develop sensitivities to different foods. And if we have multiple foods, it's not a food problem and it's not really a gut problem. It's really that our immune system is out of balance and we're producing too many antibodies too easily. And that comes down to really the way the brain is regulating it. And there are very specific things we need to do to address that with supplements.
Mm. Yeah, I think you explained that so well, that development of the gut and the immune system early on. And yeah, I think that is something that a lot of people don't understand, that the gut is kind of babies are born with a leaky gut. And yeah, I think you explained that really well. Again, I think, a really different way and a different approach of kind of addressing these immune and gut issues that we're seeing in kids. So yeah, appreciate you explaining that to everyone. Let's switch gears and talk a bit about lifestyle factors now, physical activity, the amount of time that our kids are spending on screens versus the amount of time they're spending outside in the fresh air. I mean, this is a huge problem in terms of our modern lifestyle. I know both here in Australia and I'm sure in the US. So what are your thoughts on these kind of lifestyle factors when it comes to brain health?
Well, when we look at something like autism, 30 years ago, it was diagnosed 1 in 10,000 children in the United States. Now the CDC has said that it's 1 in 36 or 1 in 24 boys.
Wow.
All of that is because of improved recognition, but more than half of it has nothing to do with that. It signifies real changes and real increases. So there's a lot more kids that are having these issues that never had them before. And the only way you can explain that is through lifestyle and through environmental factors that are having an impact and affecting brain development. And that really starts with diet and nutrition and, inflammation in our bodies. It starts with, looking at, there's no coincidence with the same things driving the epidemic of obesity and diabetes and hypertension that we see in adults and in kids, that those are the same lifestyle factors that are causing this increase in neurobehavioral issues that we see and mental health issues in adults. Because we know that most mental health issues in adults really start in childhood. So that even things like schizophrenia, which show up in the 20s, or bipolar, which may not show up till even after that, that really they start in early childhood in the first few years. And it has to do with, a lot of different factors. And number one is movement. Number one thing that is most important for developing brains, and the reason why we have brains on the planet, and when we look at the evolution and development of brains in different animals, is that the more complex movement, the more complex brain. And humans have the most complex movement, which is bipedalism. Walking on 2 feet is very, very hard, and no other animal has really achieved it like we have. But the most complex movement is speech. And so we have, kids that, are really delayed often in walking and really delayed in their movement. And then also, it's not surprising that they're really delayed or can't speak because it's really hard to do it. And you have to be really connected to your body in which to do that. And so movement is really what has probably changed the most. When I was a kid growing up, we were out all day outside, riding our bikes, playing with our friends. There was really nothing on TV to watch. Our parents wouldn't let us at home watch TV. In the summertime, even if it was 90 degrees, we were outside in a pool or something, or in water. And now we see that kids don't move anywhere near like they used to. And part of that is we're afraid to let them outside. We're afraid because we're more aware of dangers. And, maybe the world is a more dangerous place, but certainly we're more aware of it. And God forbid our kid goes outside and, goes riding down the block and they don't have a cell phone on them. And, and the socialization, and where kids would all play together and they would learn the rules of social development and, be able to fend for themselves and, didn't want to come home, didn't want to be inside, or kids even before that, they used to work on the fields or be outside all the time. That is the way our brains, and humans in particular, are more dependent on movement than even apes or gorillas. They don't move as much as we're supposed to move. It's estimated that, if you look at hunter-gatherer lifestyle now of some tribes that are out there, they're moving and walking or running 15 to 18 kilometers a day, every day on average. And we're happy if we get 10 to 15,000 steps in, right?
Which most of us aren't even doing that.
Right. Sitting in front of a computer has become our main lifestyle, our main form of entertainment. And in children, it's really devastating. Not only because the screens themselves have an effect on the brain, and the video games and the software is literally designed to really stimulate their left brain, but also because they're not moving their bodies, they're not moving their big muscles. And that is the most damaging thing that we see. So, not moving, not being able to be outside in nature, in the world, these are things combined with, not eating really ideally, more inflammation, more obesity. All of these things in combination are really, what is driving this epidemic of neurobehavioral disorders and mental health, and all of the autoimmunity and everything else that we see at this point.
Yeah. And I mean, as parents, we're just up against so much. I mean, I have 2 teenagers and it feels like a full-time job sometimes to keep them off their screens and get them outside. I'm lucky my 16-year-old son is crazy about mountain biking. And so he, so I think getting them into those outdoor hobbies, which is easier for some kids than others, and some kids just, pick them up naturally. But I just think, I feel like he spends too much time indoors on his screen, and he's got that, he's out and about a lot more than other kids are, but it's still, the days where he is home, it's hard to keep him off his phone and off the YouTube channel, the YouTube channels that he loves. But yeah, that movement I think is so important. But I just wanted to kind of say, illustrate that point that as parents, this is hard work. And when all other kids are at home on their screens, like what are our kids going to do when we're trying to encourage them to get outside? It's really not easy.
It is not easy, and I understand that. And believe me, that's why I think it's so important to really, it's very hard when they get to be teenagers. And so many of the habits of building their lifestyle really need to start early on. And the biggest thing for me is, all right, if we have teenagers and they have their cell phones and everything, but it's really kids that are like 1 or 2 or 3 or 4 or 5 that are on these devices all the time, and where that has become the babysitter. And if there's one thing I can really emphasize to parents is that, especially in the first 2 to 3 years of life, when the right brain is supposed to be developing, if you expose them to technology or screens too much, it brings their left brain online too early. And the right brain is all about social and emotional development, and also really connecting to our body and our immune system and our ability to self-regulate and really reduce inflammation in our body and digest food and all of that. And the right brain is really the social intelligence and the emotional intelligence part of our brain. And that is the area that we see the greatest rise. I mean, we have a lot of kids also that have more left brain delays with things like dyslexia and learning disabilities and certain types of ADHD. But by far, the rise of these right brain deficits like autism, OCD, tics, Tourette's, certain types of anxiety, hyperactivity, anger, impulsivity, all of that, oppositional defiant disorder. These are really this rise of these left brain issues. And all of it is really the right brain doesn't fully develop. It doesn't have a chance to mature because we're bombarding this left brain, because the left brain feeds the left brain. Technology feeds the left brain. Video games, YouTube videos constantly is feeding that left brain. And, listen, I mean, up until just really the past few decades, no child was raised on computers or cell phones. So, parents need to get that through their head, that these are not necessities. And you're not a bad parent. And you're not, my wife and I, when we talk about lifestyle and how to handle these things at home, we did a web series a few years ago called Disconnected Kids, Reconnected Families. And it was where we took a couple of families that had, we gave them a scholarship to come to one of our centers, and they were really struggling with a lot of issues around the home and around the relationship and around, diet and nutrition and discipline and, basic things. And so my wife and I would go into their home and really work with the family, not only have the child come to the center, but also where we would work with them. And we filmed it. And it actually was picked up by a new streaming network that was started by Kathy Ireland called Your Home TV. And so last year, about a year ago, it came online for the first time. And now that show has been #1 on that network since it first appeared. And it has over 3 million views in less than a year. And people are watching the whole season of both seasons. Every show has thousands of views because it resonates with people on what to do and how to handle these things at home. But really, I think the biggest danger is that, when you have these little like 1-year-old and 2-year-olds, and I mean, I have these friends of ours who have a child who's like was like 8 weeks old, and the child was getting agitated, and they gave the phone to him, and this was the grandmother, and my wife was like, "What are you doing?" And she's like, "Oh, you'll see. When you have a grandchild, you're going to see that you're going to give them the phone." And my wife was like, "No way. There's no way I'm going to do that. Like, pick the child up or play with them or do something. Don't immediately go to this phone." And it's really, it's something that it's so preventable. It's something that, is really so important. And it doesn't replace human interaction. And it really should be for the first 6 years, at least, when both the right brain and the left brain are developing, but especially that first 3 years, when you're talking about the foundation of attachment, of how they're going to form relationships for the rest of their life with men or women that's going to be formed in the first year, that how they're going to be able to self-regulate and emotionally regulate themselves later on in life, how they're going to be connected to their body and regulate their body. All of that is really being formed in those first 3 years. So I would say to parents that, it's one thing about teenage years, but really building those habits, getting them outside, not worrying about, flashcards. And if they're going to know how to build technology and code, they should be outside playing and being out in nature and developing their body and big skills and interacting with other people and reading facial expressions and understanding all of that stuff. That's really what the first 3 years is about. And you can't get that back. You can go back and we can change that at any point. But that's the one thing I would say, is that if we can really be aware of not using any technology other than, if they're sitting in front of a TV once in a while or something, but even that should be really limited in the first 3 years.
Such an important point, and I totally agree. And I love the point you're making is, yes, the stuff they're doing on screens is potentially causing imbalances, but it's the other things that they're missing out on: the social interaction, the physical movement, when we fast forward to the teenage years, the healthy risk taking, all of that stuff. If they're just sitting there on their screens, they're just missing so much of life and that important stuff for overall well-being, aren't they?
Yeah, and someone, a parent just spoke to me and recently was saying how even now when kids, like in teenagers or even younger kids, when they're together in groups to play together, they're not interacting. They're on their own phones and they're just sitting there. They're all scrolling on their phones. They're all in the same room, but they're not sitting and talking and playing and laughing and joking and playing basketball or football or whatever it is. They're, even when they're together now, they're by themselves on their technology. And it really is a big problem. And it's hard because, my wife and I, like I said, we did this show and we would also talk to parents. And one parent called us up once and said that, he had a rule in his family that, he had to have full access to any of their computers and their passwords, and that periodically he would check it. And if they cleared their history on their computer, they would lose their computer for at least a week and their cell phone, because he knew they were probably doing something they shouldn't. And so his daughter did that. She had cleared her history. So he said, all right, well, no computer or phone for a week. And the daughter went over a friend's house. And the friend's mother called the father. Now, this girl was relatively young, like 13 years old. And she called the father and told him he was abusive, because that was abusive in this day and age to not let his daughter have a computer and a cell phone because everybody else does. And it was literally like child abuse. Like, she actually called him up and said that. Wow. And it was like, to me, that's insanity.
Yeah.
Right? But this is what we're dealing with, these types of peer pressure. I remember when, video games and everything, my children, they were just coming out. And, Grand Theft Auto had come out. And, we just had no video games in our house. I mean, that was just wasn't going to happen. And I remember it came out and it was a big thing, and it was really getting popular. And we went to a party in our neighborhood, and parents were talking about it. And they were talking about how they've seen it, and it's terrible. Like, running people over, and they had like hookers in it. And, really, like, one part of it is they go through a mall and kill people, like literally in a mall, right? And they knew that this was bad, but they were like, but now we can't get our kid to stop it. And they looked at us and they knew what I did. And they said, Rob, how do you handle us? And we just looked, we said, we don't have video games in our house. And they looked at us and they said, how do you get away with that? And we said, what do you mean? Like, we're the parents.
Yes.
Like, who's running your household?
Yeah.
Right? Like, when I say, my kid is always eating cookies or eating crap. And we're like, who's buying it?
Yeah.
Are they going to the grocery store and buying it? Are they buying soda? Are they buying these junk food? Don't buy it, right? I mean, people think that, this is, parents have lost the ability to realize that you need to control your household, that you need to, that your kids, you can't let the kids run the roost. You have to be the parent. And, what you say goes, and you have to use your judgment, and don't let other people and other peer pressure, really decide who's going to raise your child. My wife said all the time, and I actually did a chapter in one of my books, like, who's raising our children? And it's not the parents so much anymore.
Yeah. That's such a good point. So important to have those boundaries. I know, going back to my teenagers, I have like time limits on their phone. So I've got a family link app. So it's all controlled on my app. I can just switch off their phones, and they absolutely hate it. And they say, no one else has this. And, but it's the only way that I can control, like manage their time. So I think it's really important that we have boundaries, and we have conversations with our kids about why we're doing it. And they're not going to like it at the time, but when we know it's best for them long term, I think it's so important.
That's really the key point, right? Because they don't know what's best for them. And it's like, I use the example, that some people and some researchers has really looked at, what is called digital heroin. Like, literally, digital technology has an effect on the brain like heroin. It literally affects the same networks, the reward center of the brain, the dopamine networks in the brain. And so I use the example of parents, and I'll say, you have to limit the phone or the computer. They said, but, it makes them happy, and nothing else makes them happy. And,
makes them quiet.
And it makes them quiet. And I said, okay, well, just think about it this way. Imagine I just said to you that, don't give your kid heroin. And you said to me, but it makes them happy, and it calms them down, and it makes them feel good, and nothing else really makes them happy anymore. And would you be like, okay, yeah, give them heroin? No, right?
God, such a good example.
Yeah, you have to really, it's like crack for them. It's really, and you have to be the parent. And I see so many kids, and many kids, even at a certain point, they'll tell me, like, that they have no respect for their parents. Like, they're like, my parents are going to give in to me. Like, if I yell and scream enough, if I'm really, if I do it enough, they're going to eventually give me what I want, and I know it. And that's why I do it. Right. And they, kids want to respect their parents. They want to look up to their parents. They know they shouldn't be in the lead. They know they shouldn't be running their own life and making these decisions, even if they're raging and screaming against it. And, the parents just have to think about it. I mean, through all of human history, no one had cell phones. How did we all survive? Right. So the fact is, the fact that they would scream or yell that they don't have their phones, it's kind of like, you kidding me? Like, there are kids starving in the world, and you're going crazy because you don't have your cell phone. And I understand that, I understand the real world. These are the real challenges, but a lot of it is a mentality, just really having a mentality, and really going back to like old school parenting. Like, I'm not talking about, things like hitting kids and stuff. I'm talking about just being like, listen, mom and dad, we run the house, and we make the decisions, and we know what's best for you. and you don't always know what's best for you. So we need to be in charge. We need to make sure that you're safe. We need to make sure that you get, and most of the kids are going to be much happier that way.
Yeah. And especially when we know all the damage that these things are, creating long term, so it's so important, such an important conversation. I could talk to you for another couple of hours, but I know your time is precious, and you're a busy man. So can you tell our listeners where they can find out more about your incredible work, your books, your courses, and also I know you train other health practitioners in your method. So, I'm sure your waiting list is miles long, but parents can get help from other practitioners that have been trained by you. So can you tell us about all of that?
Sure. My website is drrobertmelillo.com. So you see Melillo Method in the Melillo in the background. That's how it's spelled. My primary book really is Disconnected Kids, which has been translated into 15 or 16 languages. And we're coming out with the third edition. It'll be out in August, and people can pre-order it now on Amazon or any other place they get books. And I have, a number of other books that I've written. They can also, if they want to read any of our research papers, we came out with about 8 different papers in some of the top journals in the world last year. So they can just, do Google Scholar or go to PubMed, and they can put my name in and find a lot of our research papers. I'm really active on social media, Instagram at Dr. Robert Melillo. I have a lot of videos that we put out there. You also hear from a lot of parents and families that we work with. One of the parents we worked with was a very famous actor here called Kevin James, who was in a series called The King of Queens. He was also in many, many movies. And he was just recently on Joe Rogan's podcast. I don't know if you know who Joe Rogan is. It's the #1 podcast. And he talked about how his oldest daughter, who was on the spectrum, had developed these horrible tics, and no one could help her. And so they read my book. They brought her in, and we were able to get rid of her tics in about 3 weeks, and also help her dramatically with many other things like eczema and not sleeping and social development and emotional development. And she's doing great. And so, there's a lot of videos like that on there, and Facebook, of course, as well. And like I said, if you go to Instagram or go to anything, you can also find Your Home TV, where we have our web series, Disconnected Kids, Reconnected Families. And those are web series of short episodes that really, resonate. And I've also just started doing my own podcast, called the Melillo Method Podcast, Everything Brain. We just came out with our first show on right brain anxiety. The take we have when we do a podcast is really, so many people out there talking about biohacking and all these things, but we want to look at really specific issues and what is actually happening in the brain and what that means practically. What can you do about it at home? And, all my books are about what to do at home, putting it into the hands of the parents, understanding your own child's brain. What is the actual problem? And most people, when they read it, their first reaction is, wow, this makes so much sense, and nobody ever explained this to me. I have had practitioners. We do have practitioners around the world that are certified in the Melillo Method. We have an office here where we have a large capacity, and we see people, and we try to get people in quickly here, so there isn't too long of a wait, because we know that people, when they're urgent, but there are other practitioners. And if you go on my website, we have a whole list, and we recently posted this on my Instagram as well, so that they can find where a practitioner may be locally. And we have a bunch of them in Australia, that are really, really great. And, so those are all the resources that we have out there.
Amazing. Thank you. And I will make sure all of those links are in the show notes so everyone can find those really easily. I really want to check out this your home TV series, Disconnected Kids and Reconnected Families, because I think that sounds, really helpful. Thank you so much for joining me. It has been a pleasure to share your wisdom on the podcast today.
Oh, it's my pleasure. And again, none of what I say ever is meant to come off, sounding judgmental. I know parents are out there and I work with them every day, and parents are my inspiration, the sacrifices that they make. And I realize that these are, they're all new challenges that no generation has ever faced before. And I have nothing but the utmost respect for parents. And, and it's not, none of this is meant to make people feel like they did something wrong or any of this is their fault. It's not. I'm just trying to share as much information as I can and give my perspective of what I would do with my own children, my own grandchildren, and just say that if you walk in my office, my wife got me a sign that says "Hope lives here." That there's always hope, and people are often, the first thing that happens is hope is taken away from them. They're told there's nothing they can do, just learn to live with it. And that's not true. That there's always hope and there's always things that can change. And usually it's really a lot easier and it's a lot quicker than you think. So, again, I hope they understand that I just have nothing but love for parents out there. And again, I was a parent of 3 children that are amazing adults now that all struggled. So I understand where I'm coming from there. And I'm just trying to give more like a fatherly advice.
Yes, and I love the advice that you've given today. I think so many great reminders as well as so much amazing information that you've shared. So thank you so much again.
My pleasure. Thank you.
Thank you so much for joining me on the podcast today. Head on over to our website, naturalsuperkids.com, for the show notes for this episode, as well as a whole heap of inspiration to help you raise healthy and happy kids. I'll see you next week. Before you go, don't forget about my free online on-demand masterclass, 3 simple ways to naturally boost your kids' immunity to avoid a winter full of sickness. I'm sharing my practical tips on ways that you can strengthen your whole family's immune system to avoid the onslaught of winter infections so your family can stay healthy and well this winter. You can sign up at naturalsuperkids.com/immune.